Hi everyone, I'm Jose Mourinho. I think I know a few of you. I'm one of the dentists at Metro Dental, and today I'd like to talk to you about how to keep your teeth healthy and how you can make them look even better. So your smile is the first thing people notice, and according to several studies, the first feature that people notice about another person is their smile. Secondly, their eyes. So an attractive smile is very important for first positive impressions, especially when it comes to a first meeting or a job interview. And smiling actually offers more benefits than you may have realized. There are several different benefits you can achieve from smiling, such as boosting your immune system, relieving stress, lowering blood pressure, releasing endorphins, which help reduce stress and anxiety levels, and will also make you look friendly, so people are more likely to engage with you. So I want to make sure none of you will end up with a smile looking like that, so you can always smile confidently. And the bottom line for smiles that are healthy and attractive comes down to how well you look after them. So to prevent your smile from looking like this one, make sure you always brush twice a day with a fluoride toothpaste for 2 to 3 minutes. Use an electric toothbrush as they've been shown to be more efficient at removing food plaque. Floss between your teeth once a day. Avoid any sugary snacks, and if you clench or grind your teeth, wear a mouth guard because that will protect them, and don't smoke because it's very bad for your gums. Hygienist. Visiting the hygienist every 6 to 12 months is probably one of the most important things you should be doing to keep your teeth and your gums healthy. And the hygienist only removes any harmful bacteria and food plaque left on your teeth and gums, but she can also normally help to remove superficial stains and make your teeth look slightly brighter, as in this example. If you want to further improve your smile, then whitening is probably the best first option. And whitening is a process where tooth discoloration is whitened to a lighter shade by removing the staining agent through chemical means. It is a safe procedure when carried out under professional supervision. And treatment results usually depend on the severity of the discoloration, but it's not effective on dental restoration such as fillings or crowns. While you whiten your teeth, you may experience some sensitivity for a short period of time, which is normal, and it soon fades away once you finish the treatment. Products provided by non-dentists often do not have enough safety data and evidence to support their use, so they can result in burned gums and blistered lips, or even more serious consequences, so try to avoid them. The most effective way of whitening your teeth is done with the use of custom-made trays, like in the picture. All you then need to do is you apply the gel that comes in the syringes to the trays, and you sleep with them for 2 to 4 weeks. You should expect a result similar to this one, and this took about 2 weeks from start to finish. Okay. For people that have crowded teeth and want that straight white smile, then you should first align the teeth before whitening. And the options to straighten your teeth are the traditional metal train tracks, which probably most of you don't want to. So there are a lot more cosmetic braces available, such as clear train tracks fitted at the front of the teeth with a tooth-collared wire. The one on the bottom left is called Invisalign, where it involves the use of wearing these removable trays for a period of time, or the most invisible option, which is metal train tracks fitted behind the teeth, so no one will be able to tell that you're wearing them. A good dentist should normally be able to achieve similar results with all types of braces. If anyone has any questions, feel free to stop me and ask. So these are just a couple of examples I wanted to show you to give you an idea of what can be achieved with braces. And this top one was finished with clear train tracks. It took about 9 months from start to finish, and I had to see the patient at least once a month. And this was the result that we managed to get. This bottom one was done with Invisalign, so the removable trays. It took around 12 months from start to finish. And at the end of the treatment, I also use what's called composite bonding, where it's a little resin that'll come onto the next slide, which is added on the teeth to make them look slightly longer and a better shape. So another way of achieving that straight white smile is by the use of composite bonding. And this involves bonding a tooth color resin directly on the patient's teeth. And I use it routinely as a cosmetic option to repair broken teeth or change the shape of small and gappy teeth. And you can also make them look a bit brighter. In this example, my patient's teeth looked like they were chipped, but this was actually due to excessive drinking of smoothies for about 3 years, which actually dissolved away the enamel of the teeth and made them look sort of uneven and short. So I had to build them all up again in composite bonding to give them the normal length again. The advantages of this procedure are the fact that I don't need to shave off any tooth surface, and it can normally be done in 1 or 2 visits. The disadvantages are the fact that you can stain with time and it will chip away. Normally looks at its best about 5 to 6 years. But if you want to get that Hollywood smile, then you do need porcelain veneers. And with porcelain veneers, we can make your teeth look perfect. We can get the veneers to change the shape of your teeth to make them as white as possible. But there's a lot of work involved in it, and it normally takes at least 3 visits. They are individually made by a lab technician. And like composite bonding, they do not discolor or get stained with time. They normally last about 15 to 20 years. In this example, the patient did not like the shape or the color of her teeth. She also had several fillings in between the teeth. They had been replaced several times, but they keep staining with time. Her teeth were slightly misaligned as well, and they were a little bit longer than ideal for her facial structure. So after careful photographic evaluation by myself and the lab technician, we came up with the final veneers to fit her smile and facial structure, and she decided she wanted them brighter but to still look natural. There was a lot of background work involved in creating this bespoke smile, but the patient was delighted, and so was I with the result. So thank you for listening, everyone. It was quite a short and quick